I would like to share my knowledge and also my experience in the context of addressing health needs of vulnerable populations. I would like to bring a case study in Australia, in Queensland particularly, as how Queensland government deal with refugees in Queensland or in Brisbane. Okay, so I also would like to then connect with the theme, the main theme of this symposium, which is SDG and also sports, because Griffith University is also very much interested in doing sports as well. And we as academic, we are encouraged to also do physical activities every week and even like every day. And we are also encouraged to wear active, we call it active wear. So we are not encouraged to wear shoes like this. So when I'm teaching in Brisbane, I always use sport shoes because that is basically to encourage us to walk. Because if you go to Brisbane or in Australia, because Mbak Desi also from Melbourne, so we are very much encouraged to walk from one spot to another spot. Okay, but here sometimes we just use ojek, right? Just for short distance we use ojek, but there, because there is no ojek, you have to walk. Okay. So in my short presentation, because the moderator gave me about 40 minutes to present, so there are 5 key points I would like to address in my presentation. The first one is we need to understand what are the health needs. Okay, when we mention about health and well-being, we also need to understand what is health and what is well-being. And I'm happy that you now also talk about well-being as well, because oftenly Indonesia only concerned about health, but in Malang we also discuss about how we can also improve our well-being, not only health. And in the context of vulnerability, we also need to understand who are considered to be vulnerable and what is vulnerability, what elements that can cause a group of people become vulnerable to a particular threat. Okay, and I also would like to bring a case study of how Queensland government deal with refugee, because we have lots of refugee coming from different countries, especially from Iraq, Syria, from Yemen, and they, to my perspective, they are considered as vulnerable because they don't have, because of conflict situations, they did not receive basic, health services in their home country. And then last one is take-home messages. So let's go to the first one. We need to understand that that health, this is a very timely moment, in the context of global health. Not last week, even yesterday, I had a meeting with Minister of Defense of Republic of Indonesia. In that meeting, we also have participants coming from Ministry of Health and Ministry of Environment and Forestry. So in that meeting, the Indonesian government concerned about global health security, pandemic, disease, because disease is a threat, especially in the context of climate change, right? We have vector-borne disease, and Indonesia is the second country who have lot of dengue prevalence. The first one is Brazil, and Indonesia is the second one. Okay, but I think last night when I arrived in Malang, and I've never seen any single mosquito. I think this is a very good indicator. Like even in this hotel, I've never seen any a single mosquito. So I think this is a good indicator, because last week I was in Medan and also in Surabaya in a university there, and then quite a lot of mosquito in that university. I think this is something that needs to be concerned. So air pollution is something that we need to be concerned as well. PM 2.5 I think Malang is considered to be okay, but if you look at Surabaya, Jakarta, their air pollution is quite worrying, right? So because of many things, because of transport, because of traffic, traffic jam, and also, not to mention also other, things like, for example, people also burn their waste back home, for example. In Jakarta, it is no longer allowed, for you to burn your waste behind your house, for example. But in Surabaya, last week I saw many people still burn their waste behind their house. So the emergence of spread of drug resistance, okay? We also will face this problem as well, the superbug, because many of us, we maybe consume antibiotics, and also if in agriculture area, hopefully not in Malang, but in agriculture area, often they also use antibiotics for their cattle, even also for their vegetables as well. That's why in Australia, especially in Queensland, they are very selective. So they do not want to import vegetables from China, for example, because in China they use antibiotics for their vegetables. So if we consume the vegetables, the antibiotic will also go inside our body. So another thing that we need to concern as well in regards to global health, that we have quite a number of emerging epidemic or new emerging or re-emerging infectious diseases. We have Ebola, SARS, hopefully not Zika. But that's why last year our university hosts an international sport games, which is Commonwealth Games. This is a games like Olympic Games for Commonwealth countries. I think Malaysia also sent their representative to be part of these games as well. So we are very concerned about these games, because if you remember about Olympic Games in Rio, in Brazil, few years back, there was an outbreak of Zika virus. So Australia was very concerned about this, because many people will come to Queensland. Of course, they will bring money, okay? But they might also bring disease as well. They might bring virus as well. Okay, so but fortunately, there is no single case of Zika virus during this event in Gold Coast. Natural disaster is something that need to be concerned as well. They call Indonesia as a supermarket of disaster, or I call Indonesia as a laboratory of disaster, because supermarket is not a good term, because you actually buy something there. But laboratory I think it's more scientific and also more academic, because you learn something. Even Australia, we learn a lot of disaster from Indonesia, because in Australia we only have bushfire and cyclone and floods, but Indonesia we have quite a number of type of disasters. Tobacco is also very concerning in Indonesia, because we still the fighting, with tobacco companies is very difficult in Indonesia. In Australia, they will increase the minimum age to buy cigarette is 21 years old. So if you're not 21 years old, you cannot buy cigarette, and the price of a pack of cigarette is $40. Jadi 400.000 rupiah untuk satu pack cigarette. So basically, at the end of the day, it is your own choice. If you want to smoke, okay, but you have to be above 21 years old, and you have to spend $40 for one pack of cigarette. Okay, we also have quite a number of non-communicable diseases as well. So it's a double burden, okay? It's even triple burden, in fact. So we have cancer, diabetes, obesity, and also chronic lung diseases in Indonesia is also getting worrying as well. And not to mention as well, last but not least, we have also terrorisms. That's part of public health threats as well. We also need to consider that as a public health threats, especially in the context of bioterrorism. In this world, there are a group of clever people, they're very smart people, they create virus just to cause trouble, okay, to introduce harm or threats to other populations. So we also need to consider this as a threat. That's why yesterday when we had meeting with Minister of Defense, they consider this as a potential threat in Indonesia, okay? So probably it's a bit too small for you to look at, but I'm trying to. So the first, this is in the context of global. So we have still the first one is stroke, heart disease. I'm not going to read all of them, but I just would like to focus on this. So 8.2 million out of 12.6 million deaths caused by the environment, okay, and are due to non-communicable disease. So I would like to highlight this word, the environment. So the environment is very important for us, okay? So the environment is very important for us so that we have, how we can actually create supportive environment so that we can become healthy and also have a good well-being as well. And this is also another problem that we are facing, globalizations, industrializations, okay? If you look at this global cheap labor, okay? We have all this, look at this, pollutions and CO2 emissions, environmental destructions, consumer junk, and natural resources are depleting because they use a lot of natural resources and they pay cheap labor. That's why a lot of big companies, they move from one country to another country. Like for example, if I now buy let's say a jeans in Brisbane, previously maybe it is made in Indonesia, previously. Most of Levi's, like branded jeans, it is made in Indonesia, but now it is made in Bangladesh because they moved the company to another country because they can provide cheaper labor, okay? And I have one student, PhD student from Bangladesh. They do, the research was about, so because he graduated already, the research was about occupational health and safety for garment factory worker in Bangladesh, in Dhaka, because their health and safety condition is very poor, okay? They don't have time for sleep. They don't have time for eating, for toilet, okay? Because they have to produce as many as possible product in one day, okay? And it is branded items. You can go to supermarket, big shopping center, it is branded expensive, but they actually pay very cheap labor. So it's unfair. So if you look at this, this is something that we also need to concern as well. Especially in the context of urban settings, 80% of urban residents are exposed to air quality levels that exceed WHO limits, okay? So this is something that needs to be considered as well. And when we talk about vulnerability, we also need to look at vulnerability to what? To what exposure, okay? Like cheap labor, so this is what I was talking about. This is, I think, in China. Pollutions. The world is full with rubbish. And if you look at this at the bottom, Indonesia is the second largest plastic polluters, okay? So maybe next year, if we have this another international symposium or international scientific meeting, so maybe we can avoid using plastic, okay? So we don't have to use plastic bottles in our table. So we can always use glass, or we can ask people to bring their own tumblers, reusable bottle, so then we can always fill our bottle with maybe with water dispenser, because Indonesia is the second largest plastic polluters after China. So this is knows no borders. So for virus to travel from one country to another country, they don't need passport. Unlike us, human, we need passport to go to Australia, to go to Malaysia, to go to Myanmar, to go to Thailand. But for virus, they do not need any passport. they knows no borders. So it is a borderless. So we have to work together now because we can share the solutions, but we can also share the problems. Okay? And this is very scary. An outbreak that starts in another country can hit our shores in matters of hours. As we protect across the globe, we also protect here at home. So basically, if there is any outbreak in a particular country, let's say in Africa, okay? If you know that there is a pandemic in a particular country, and because of the world is getting smaller, which means that because everyone can fly now, that is the motto of Air Asia, everyone can fly. It is cheap for us to buy airplane ticket. So that particular disease can also exist in our environment as well, in our settings. So in a nutshell, so we are actually, this is a very good publication, which is published by the Lancet. Okay, and it's a free, free to download as well. You can always download the full document. It is actually mentioned about this, the AMR, the zoonotic disease, sustainable development. So basically, it's also similar, relevant to the topic that we are talking about. And the last but not least, here we say that the developing countries, because Indonesia is developing countries, and we are now developing, okay? But we are doing it so fast. We are developing this, environment so fast. And sometimes the environment cannot address, the risks, and that will also impact the human itself. And this is also very scary, because of climate change, the unprecedented health risks and disaster, and we also face uncertainties in the future. We don't know what will be the risks in the future. It might be, we can face maybe more floodings, more vector-borne disease because of changing in climate variability. Again, not to forget, the heaviest burden will fall on the vulnerable populations, for example, the poor, and widening already unacceptable gaps in health outcomes. Because the poor, they probably have issue with, basic health care, but because of all these health threats, they will impact the most. So what is vulnerability? So this will be the second part. So in the context of disaster point of view, because that's one of my expertise, so it's a measure of propensity of an object, area, individual, group, community, country, or other entity that incur the consequences of hazards. Okay, so vulnerability can be defined as exposure to potential harm, okay, and from the effects of disaster agents or disease on the built environment. Vulnerability is the result of, so this is the three elements: susceptibility, resilience, and also resistance within the community or institutions. So three elements, what are those? Resistance, okay. For example, the quality of houses, so looking at the physical quality, okay. But we also have susceptibility, exposure to hazard. For example, when I first came to Surabaya, after quite sometimes, I lived in Brisbane for 1 year and then come to Surabaya, they took me to Soto Cakhar. Yeah, Soto Cakhar is a very delicious food in Surabaya. And I put a lot of sambal, and because of that, I got diarrhea. So I become more susceptible to diarrhea than my other friends. Okay, my other UNAIR friends, they also put a lot of chili, but they're okay. But because maybe I live in Brisbane for quite some time, I become more susceptible for E. coli or for any other pathogen. Okay, that just an example. So every one of us have different susceptibility to a particular threats. And resiliency, this is more in the context of systems. Do we have, in the context of disaster, do we have disaster management systems? In the context of disease, Do we have proper surveillance systems? And also, what about access to finance? Like in Jakarta, to some wealthy people, if Jakarta floodings, if their house is flooded, they just leave their house and they move to a hotel for a week, for example. And then a week later, they will come back to their house and the insurance has already taken care of everything, and they will then start, live in their house again. So they have no issue with floodings because they have access to financial systems and insurance as well. So this is three parts that we need to understand when we try to look at the vulnerability of a population to a specific threats. So I'm not going to explain all this in detail, but I'd just like to maybe show some of them because it's quite small. I'm not too sure whether you can read those. So vulnerabilities can be also grouped into 6 elements. The first one is physical, so social, cultural, political, economic, technological. So these are the 6 groups of vulnerabilities. Just take one example, okay? Let's say cultural. We look at this, lots of traditional coping measures, okay? This can be an aspect of vulnerability. We have local wisdom, okay? Every province, every community, they have their own local wisdom in solving a particular problems. Even also in the context of health. When I went to Medan earlier this week, and they have also a conference there, and public health and traditional medicines. So traditional medicines, they bring this as they want to highlight this as well in their conference. And I look at there are quite a number of traditional way of Indonesian people of dealing with different health issues. And as a researcher, we have to check whether the validity of this, the reliability of these measures or these interventions. And maybe this is also to show that we are actually very rich with knowledge in the context of Indonesia. And that's why we have one speaker coming from Australia in Medan, and he is also from Melbourne, and he is a medical doctor, but he is expertise in traditional medicines and herbal medicines. So I'm quite surprised we have Aussie, like real Aussie. I'm Aussie, but I'm not real Aussie. I'm from Indonesia. But his research is on herbal medicine, so like honey and other kind of herbal things. So it's very interesting. So now let's talk about health and well-being, because vulnerable populations, because this is the topic that you gave me. So vulnerable population can be many, can be varied, like maybe disabled group, poor people, even like pregnant mother, or those who don't have access to health service. Those are vulnerable people. But let's see health and well-being. I'm just quickly, because I know that all people in this room are experts in health, so I'm not going to repeat this very basic concept. But I just want to show highlight the first one. Health is holistic, and has physical, social, mental, spiritual dimensions. And it is also very important. Health means different things to different people, okay? Different culture have different needs, okay? Every time I teach, because in Brisbane I have about maybe 124 students, Master of Public Health, and coming from 29 different countries. So I have students from Kenya, students from Nigeria, students from Indonesia, Malaysia, Singapore, Thailand, Myanmar, Hungary, UK. So they're all coming from different culture. That's why at the end of the semester, I always ask students to bring their own traditional food to share. So you can taste 29 different traditional foods, you can imagine. But when I ask about culture, they also have different perspectives about culture, belief, values, norms. So we cannot treat people the same because they are coming from different culture, different background. So it is also very important for us to understand that there are multi-determinants of health and illness. Okay, we have individual, social, environmental, health services, political, legislative, financial. So all this will influence the health status of our populations. Okay, even like, for example, here we look at this policy, politics. Okay, politics is, because health is a politic, it's a politic product. Like, for example, health insurance, health system, it is a politics. That's why public health students, we also need to understand about politics. We don't have to be politicians, but we need to understand the politics. Okay? And bad politics will also bad for health, okay, as well. So we also need to understand about politics as well. So safety regulations, environmental protection law, all of these are very relevant to our how we behave and how we, how our health status. Just quickly, I took this from my course. So this is what we call by upstream, downstream approach. So health determinants are the health outcomes. So if you look at this at the bottom, this is health outcomes, and this is health determinants. So we can always have three options. The first one is whether we only want to deal with the outcomes. Okay, so this is where we are dealing with treatment, or we want to deal with midstream behavior, or we want to go up to the hill and address the root of the problems. Okay, so this is where we have what we call by whole population approaches, like land use, settlements, community awareness, educations, poverty, okay, poverty reduction. So all these are also relevant to public health. Okay? And most of us, we only deal with this, at the bottom of the hill, health outcomes, and like laboratory, scientific, medical approaches, which is very important as well. But we cannot forget this as well, the first one, the health determinant. Okay, in Queensland, we have what we call the wheel of well-being, because previously we discussed about health, and now we want to look at the well-being, because well-being can be defined quite differently to different culture as well. In the context of Queensland, this is how we define well-being. Okay, the first one is be active. So we have to be active. Keep learning. Keep learning means we always learn something new every day. Okay? And of course, we as human, let's say if we did some mistake, in the future we have to learn from those mistakes, and then we have to improve how we behave or how we act, for example. And we also have to give. So giving is very important. Okay, sharing is caring. Okay, so giving means, that's why it is quite interesting that we see, if you want to improve your well-being, you have to give a lot to other people. Like, give means charity, give donations, helping other people. This is basically to improve your well-being. Okay? And take notice. So take notice, you have to be aware of any information from your surroundings, and care. Okay? Be active means here, even we have a checklist, okay, in Queensland to check whether we have a good well-being or not. For example, they ask, what do you do in your spare time? Like, let's say I do cycling. Okay, so that is a good a good indicators that you have a good well-being, because you have other things to do in your spare time, not only doing assessment. Because students, I always remind my students, although lots of assessment need to be done, but you also have to do other things as well, like sports, physical activities, having fun with your friends. It is very important. Shopping can be dangerous as well. Shopping is sometimes fun, but it can be dangerous as well, especially if it is a lot of discount, and then, oh, I think we have to buy this, we have to buy that, and then you end up with, spend a lot of money. Yeah, you have to be careful as well. So the wheel of well-being. So we have to include all these aspects. For instance, in Queensland, we have cycling action plan. Even for cycling, we have cycling action plan for our kids. So how we can teach children so then they can cycling. Anybody in this room cannot use bicycle? So it's good. Everyone can use bicycle. Good. But I've asked friends also, like even my mom cannot ride a bicycle. So, but yeah, cycling is very important. And also, of course, you also have to think about the safety. Okay, safety regulations need to be concerned as well. Like you have to be safe when you ride your bicycle in the road.
I'm sorry, doctor. 15 more minutes.
15 more minutes. Okay,
Thank you.
Right in time. Okay, so in Brisbane, this is in my faculty. We have what we call the stress last week. So this is a week before we have assignment or we have exam. So stress less weeks because we know the anxiety getting increased among students, especially international students in our campus when we want to face exam week. So in this stress less week, we have special activity for students. First, they get free food, okay? They got free massage, they got free yoga class. They can go to cinema as well to watch movie and also go to beach as well to learn how to surf. This is basically to distract their focus on assignment, but of course they have to learn as well. They have to do their assessment because that is the cause of the anxiety. But basically this is to provide, to improve their well-being, okay? And so basically this is how we do it in Queensland. So like, for instance, this is how we provide study schedule. It is color-coded. I cannot read from here, but if you look at this, so this is study time, free time, getting ready, commuting, work, family, cooking, meals, playing sport. So if you look at this from Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, you need to have specific time for you to do physical activities, for you to do cooking, because cooking is also, it's good to improve. I cannot cook myself, but at least you can cook maybe rice, cook, instant noodles. Instant noodles is also not healthy for you, but at least you spend some time for you, to do something else aside from study. Okay, even we put reading as well and also housework, like cleaning your house. So public health, when we discuss about public health, it is a very comprehensive, approach. We are not only talking about hospital, and hospital. Okay, ecological change, how we create the environment so that the environment becomes supportive for us. Social and economic change, and also public health, okay, population health. So this is actually public health actions. And this is what we want to achieve. So community resilience, so they feel empowered. So this vulnerable group, they feel empowered. They feel that they have power to control their own health determinants. They become less vulnerable, more content with their environments, and prepared to face situation of crisis. This I already mentioned previously, so bad politics is a threat for public health. Okay? So finally, in my last section of my presentation, I would like to present the case study of refugee health in Queensland. Oh, by the way, this is Queensland. Okay, so Queensland, this is Australia. So Australia is a very big, it's a continent by itself. Okay, and this is Australia. This is Brisbane. This is Queensland. This is North Queensland, and this is Brisbane, somewhere here. Okay. So snapshot of refugee in Queensland. So each year we have 1,800 refugees settled. So you can imagine 1,800 refugees coming to Queensland. I don't know the figure for the whole Australia, but this is the figure of Queensland. Okay, so we have people coming from different places, especially from Iraq, Syria. And there are approximately 3,000 asylum seekers currently residing in Queensland under a variety of visa classes. Okay, in 2015, the Australian government committed to settle an additional 12,000 refugees. So this is the whole nations. from Syria and Iraq. Okay, and you know that in their home country they have conflicts, war. So we could expect people who come to Queensland, they don't, maybe, what about their maybe vaccine, you know, their maybe basic health services like for kids, babies, pregnant mother, maybe they did not receive that in their home country. Okay, that potential threat as well for Australia. So under this additional commitment, approximately 1,400 coming from Syria and Iraq in Queensland. And the number is increasing. Okay, so if you look at this, this is from, from 2000 and, what year is that? From 2014, 2015, 2016, so the number is increasing. And the good thing is that the community in Queensland or in general in Australia, they welcome to this refugee. Okay, they welcome them to settle in Australia, because Australia is a big country with only 24 million people. So population density in Australia, anybody can guess what is the population density in Australia? So 1 square kilometer, only 4 people live. So in Jakarta, 1 square kilometer is 12,000 people live in this only 1 square kilometer. So you can imagine, Indonesia as the whole nation is 124 per square kilometer. So we have more cattle than human. Yeah, especially in New Zealand, we have more cattle than human in New Zealand. So, and treating refugees as the problem is the problem. So, which means now they are working on how we actually deal with this, you know, people, refugee. So, this is what I have already mentioned earlier. Health is different to different people, and understanding their needs is the key. So, understanding the needs is the key. So, which means that we need to understand the, you know, whether they, for instance, even in the context of diet, everyone has different diet, right? And I met with a friend from Malaysia, and she is a pesco-vegetarian, so she only eats fish, but she doesn't eat meat, for instance. And I also have a very, I think this is very extreme vegan. What is extreme vegan? Because this is, they don't eat anything like dairy, honey. They don't even eat like garlic. They don't even eat like carrots, because anything that grow underneath the soil, you cannot eat. So you only eat something that is above the soil, above the ground. So it's a belief as well, but I think he is from Taiwan. So even from diet perspective, you have different, you know, different needs. So what we do in Queensland, so we have 5 principles. The first one is collaboration and partnership. You have to collaborate, and you have to be partner with multiple stakeholders. Okay? And the second one is cultural responsiveness. Even in Queensland Health, in the hospital, we have a guideline how to deal with Muslim patients. With Muslim patients, because especially in the context of pregnancy, death, because we have different belief. Like, I'm a Muslim as well. So for instance, if somebody passed away, you have to be buried, this person, this disease has to be buried as soon as possible. But maybe from other culture, you can wait for a week, 2 weeks, okay? But for Muslim, you have to, this person needs to be buried straight away. So we also have this kind of, you know, cultural, you know, competence in Queensland Health as well. So cultural responsiveness, consumer and community voice. So dealing with vulnerability group, we have to also include what we call voice of the voiceless. So those who cannot speak. It doesn't mean they cannot speak physically, they cannot speak, but maybe they don't have, maybe they are minority group. So if they cannot speak in as to, like, because they are different politics, different religions, different culture, that's why they have no value at all. But we have to hear voice from these people. Continuous improvement, so we always have to improve, and also clinical excellence as the last one. So there are 7 priorities areas of actions. Okay, the first one is, no, cannot read. So communicate and collaborate with colleagues. So that's why I think these scientific meetings is very important, so that we can talk, we can collaborate, we can also discuss about how we can do something together, for instance. Okay, we can share knowledge, we can also share publications as well. So this is something that we can do in the future. And the second one is establish the statewide refugee health and well-being. So this is in the context of Australia, so we have a guideline to deal with refugee in context of nationwide. And we have to modify usual practices to meet the health and well-being needs of refugees. So because refugees coming from different culture, different needs, so we need to make sure, like for instance, in Queensland, the motto is eat 5 vegetables and 2 fruits. That's it. Okay. When I was little in Indonesia, we always have 4 sehat 5 sempurna, right? But in Queensland, we don't have that. So they don't actually encourage people to drink milk, because a lot of people, they have lactose intolerance. So, but eat 5 types of vegetables and 2 types of fruits every day. So that's it. That is their, you know, their, what is it? Their health promotions campaign. And use professional interpreter services. So basically, because they have different languages, you know, so we also, even in Queensland, we also have, like in the context of police, Queensland Police Service, I'm part of the interpreter as well for Indonesian language. So if there is anything to do with Indonesia language for Queensland Police, sometimes they call me as well to help for translations. But hopefully they do not need, I think 2 years ago they need me to interpret. There's one Indonesian person or citizen who have a issue with police. So hopefully not, you know, maybe like even this year we don't have any case, okay, which is good, okay. Engagement and with the community is very important, so you have to engage with the community. And last but not least, deliver it at evidence-based quality health care. So basically it has to be based on evidence, okay, scientific evidence. And we do a lot of research, but if that research only for publications, I think that is not useful, okay? I was actually thinking that if you do research, it has to be triple U. The first one is useful, okay? So the research that we do has to be useful, usable, and used, okay? Which means somebody or end users or policymakers can use our, you know, research to do something related to policy. So take-home messages. So this is takeaway for all of you. So this is my souvenirs coming from Brisbane. So at least there are 3 points. Okay, the first one is partnership and collaborative actions. Public health is a very complex thing. Okay, we have to work together. Maybe different institutions, different professional backgrounds, different culture, different countries. We can work together, you know, to address our health and well-being needs or issues. Improve social connectedness. So basically, we need to improve how people work together, because social conflict can be a very, you know, big threat. Like recently we have a issue with, you know, with just after our Indonesian Independence Day, right, with particular culture or race. I think we have to avoid that, you know, situation, and that happened also in Malang as well, in Malang and Surabaya. So we have to work hard, you know, to make sure our community, they have a very good connectedness between different culture. Evidence-based program planning. So we have to aim to that type of research. So we need to do translational research. So this is another topic that we can discuss later. Understanding local health needs. So we need to understand what do they need. This vulnerable group, what do they need, so then we can provide strategy that is according to their needs. Community empowerment approach, so we need to empower the community. It is not a top-down, but both top-down and bottom-up approach. We have to work together with the community. And addressing existing vulnerabilities is very important as well, especially in the context of climate change, SDGs, because we are talking about how we can achieve, the targets, the 17 targets or goals in SDGs. So we need to address our existing vulnerabilities, which means that we need to have the mapping. So what is our current priorities, and then we need to address those priorities. Okay? So thank you so much for your attentions. I look forward to have a fruitful discussion with you. Thank you so much.